Okay, we'll be looking at diagnostic imaging of the knee in this lecture. Indications for imaging of the knee include primarily pain and trauma, less commonly metabolic diseases, tumors, infections, or pre and post operative assessments will be done for imaging with the knee. So if we look at the radiographic evaluation of the knee, the more routine ones that you see in practice are the AP, the lateral. If we're suspecting something going on with the cruciate ligaments, the tunnel view or a PA view, and then we also see a sunrise or tangential view for the patella. You can also utilize a merchant view, and occasionally we'll do bilateral AP films and weight bearing if we're suspecting osteoarthritis. So the AP projection, film is underneath the knee, x-ray beams just directly over the knee, straight down. On this you should be able to see the condyles. You should see a superimposed patella over the condyles. You'll be able to see some of the tubercles here, and primarily looking at joint space and looking at some of the alignment of the femur and tibia, and possibly even some of the proximal fibula on most of these films. So like I say, the AP projection, we're looking at joint space. We're looking at the alignment here, making sure we got good alignment in density. Then look at your cartilage spaces, looking at soft tissue around it. But you're really looking, in this case, you're going to be looking at you'll be able to see the condyles very well, the tibial plateau, these little tibial spines here for some of your cruciate ligament. You should be able to see the proximal fibula. And then over this, you can see the patella that's superimposed over the femoral condyle here. So really looking for any type of line here that may indicate an osteochondral fracture within the joint, and then obviously any type of neoplasm. So here's your AP view labeled. So you got your femur, you got your patella that's set over here, fibula, tibia, so you can kind of see these little spines here. And here's one without the labeling for view as well. So really looking at this joint through the anterior posterior view is really good for getting a good picture of alignment and possible fractures. The lateral projection, so the knee's going to be slightly bent. X-ray beams pretty much straight down with film underneath the knee here. So on this, you're going to be able to see the distal femur, proximal tibia. You'll be able to see the patella sitting out here on the picture on the very front of the knee, and you'll be able to look at the tendons here, particularly the patellar tendon, and looking at ideas for where that patella is sitting in relation to the femur. So the labeling here, you can see got the fat pad there that's labeled patella. You can see some of the suprapatellar fat pad, and you see these where the muscle would be here. You got the alignment of the femur, alignment of the tibia and the fibula here. So you can, like I say, you get a good picture of kind of where that patellar tendon's at, the quad tendon at, and some of your pouches for the suprapatellar pouch is also labeled here. So really looking like mostly fractures. You may see some tibial tubercle here with Osgood slaughters. Occasionally you'll be able to pick up some soft tissue disruption because the patella will be sitting in a different place because of tears of the quad tendon or patellar tendon. So here's an actual picture of it. So you can see the patella sitting out here, femur, tibia, and fibula here. So pretty basic views here. We can do the tunnel projection. So the patient's lying prone with the film underneath the knee here. You see a projection of the x-ray beam here. Looking down and going through this, concentrate on this tunnel here between the condyles. And so here you can see the tunnel view here between the two condyles, and in there you see the tibial spines here. So these are looking at osteochondral or cartilage defects, loose bodies in relation to the ACL and PCL that are going to be inserting it here as well. So there's your tunnel view. So you can see in this case you got a growth plate here with the tibial plateau, tibia, you got the fibular head, then you got your tibial spine here, and you know the anterior cruciate ligament is going to be attaching into the tibial spine here. So you can see if there's a fracture, occasionally get an avulsion of the where the ACL pulls the bone off of the tibia here rather than rupturing the ligament. So you're always looking for those type of things, and also osteochondral defects due to ACL injuries. And here we see the sunrise view. This knee is bent up so that the beam can catch just the patella as it centers itself between the two condyles. So here you're really looking at this angle of the sulcus. You look at the patella and how it lines up into the condyles here. And you can also see the facets of the patella as well that may show some wear and tear, osteoarthritis, occasionally chondral defects. And you may see it not aligning properly here, looking like there's a possible dislocation or subluxation of the patella. So here's a more involved picture. So you can see the patella, it should be sitting in this trochlear area here. In this case, you see a fracture through the patella that you may not see on some of the other views. If you saw a lateral view, you wouldn't be able to see the fracture very well, and you may not see it well on the AP view because of the alignment here in such a small bone. It's sometimes hard to see if there's not a displacement. So here you also see a patellar dislocation here, where the subluxing outside the trochlea here. And then we have a Marchant view, which is the tangential view. Allows you to see more of the articular facets and patellar fractures as well. So you can see how they do this. So the beam is centered right over, catching just the patella onto the film plate here, and the leg is supported here by the table, and so you kind of catch this condyle here. And so there's your Marchant projection, which allows you to do both knees here in this case. So you can see the congruence here of the patella sitting in the trochlea, and then you can also analyze the depth of this sulcus here to see if there's potential for subluxations with some of your patients. Then lastly, the bilateral AP and weight bearing. So if we're really looking for osteoarthritis in particular, and how this adapts to weight bearing, we can do this weight bearing view here, bilateral AP, so they'll be able to compare knee to knee and see the joint space here. So you see a lot of subchondral sclerosis, a whitening of this edge here. You see decreased joint space. There's almost no joint space. There should be some nice joint spaces here, whereas here there's not in this medial compartment here. So opens up the lateral compartment a little bit more. So you can kind of see how osteoarthritis is affecting the knee joint. So hopefully that gives some clarification on some of these routine views of the knee, along with some of the specialty views that we'll be looking at in regards to pathology in the knee. If you have any questions, feel free to email me, and we'll also be discussing this more in detail with the clinical cases in lecture.